Hi everyone. This clip is the part 2 and continuation of the summary of your blood test results and what it translates to. Just a reminder that anything I post here is not meant to diagnose or treat anything, and it's for informational use only. For any health-related matters, please consult your healthcare provider. So continuing on the topic, next result showing is immature granulocytes. Now, normal range for that is 0.0 to 0.1. Small amounts of white blood cells may be present on a complete blood count test, whether or not you have an infection, although healthy people do not show immature granulocytes on their blood test report. Next one is NRBC. Normal range is 0. This is a test for leukemia. High levels of NRBCs generally indicate that the bone marrow is releasing immature red blood cells into the bloodstream, often as a response to stress or disease. Low or absent NRBCs typically suggest normal red blood cell production and maturation. Next, we have AST. The normal range for that is 8.0 to 33. An aspartate aminotransferase test this is a measure to give us the amount of this enzyme in the blood. So AST is normally found in red blood cells, and it's in liver, and it's in heart, muscle tissue, pancreas, and kidneys. High levels generally indicate potential liver damage or disease, while low levels are usually considered normal. Then we have GGT. Normal range is 5.0 to 40. GGT is an enzyme found throughout the body, but it's mostly found in the liver. When the liver is damaged, GGT may leak into the bloodstream. So elevated GGT often indicates liver damage or bile duct issues. Next, we have FPS. Fasting blood sugar levels. The normal range is 3.6 to 6.0, although it might be a little bit different for different individuals. High FPS typically indicates high blood sugar, while low FPS indicates low blood sugar. Both high and low FPS levels can signal potential health issues, particularly related to diabetes or other metabolic disorders. Then we have HbA1c. Normal range for that is less than 6.0 and shows what your average blood sugar or glucose level was over the past 2 or 3 months. A high HbA1c indicates consistently elevated blood sugar levels, potentially signaling diabetes or poor diabetes management. Then we have GR or glucose random. Normal range is 50 to 100. A high reading, typically 200 milligram per deciliter or higher, may indicate diabetes or poor blood sugar control in someone who has diabetes. A low reading, generally below 70 milligram per deciliter, can be a sign of hypoglycemia or low blood sugar and may be related to diabetes medications or other health conditions. We also have granulocytes in blood test with the normal range of 1500 to 8500 cells per microliter, and a high granulocyte count could mean you have some type of infection. A low granulocyte count might point to bone marrow disorders like leukemia or aplastic anemia. Then we have EGFR. Normal range for this is between 90 to 120. This is an estimated value, not a direct measurement of kidney function. A low EGFR doesn't always mean a serious problem, but it's a good idea to discuss the results with a healthcare professional, and below 60 could suggest reduced kidney function or chronic kidney disease, and below 15, it can mean kidney failure or end-stage renal disease. Then we have Na or sodium. Normal range is between 135 to 145. Low levels of sodium can cause confusion, nausea, headaches, fatigue, muscle weakness, and in severe cases, seizure or coma. Higher than normal sodium can cause excessive thirst, dry mouth, confusion, muscle twitching, and in severe cases, again, seizure or coma. Then we have K, or potassium. Normal range is between 3.5 to 5.2. High potassium may indicate kidney disease, Addison's disease, diabetes, or certain medications which can cause it. Low levels of potassium can be due to diarrhea, vomiting, certain medications like diuretics, and kidney problems. Then we have chloride. Normal range is between 96 to 106. Low or high chloride levels can indicate various health issues, including dehydration, kidney disease, heart failure, or lung disease. Then we have CO2, carbon dioxide levels. Normal range is between 23 to 29. High CO2 levels or alkalosis can indicate issues like severe vomiting, kidney problems, or lung conditions. Low CO2 levels or acidosis may suggest kidney disease, diabetic ketoacidosis, or metabolic acidosis. Then we have BUN, or blood urea nitrogen. Normal range is between 6.0 to 24. High BUN levels can indicate kidney dysfunction, dehydration, or a high protein diet, while low levels may suggest liver problems, malnutrition, or overhydration. Then we have UA, or uric acid. Normal levels are 210 to 450. High UA or uric acid levels can indicate potential health issues like gout or kidney problems, while low UA levels are less common but also can be a sign of certain conditions. Low levels can be associated with certain metabolic disorders, and some medications or reduced production of uric acid can also cause this. Then we have ALT, liver enzyme test. Normal range is less than 36. High levels of ALT typically indicates liver damage or injury, while low levels are often associated with low muscle mass or weakness, particularly in older adults. It's important to note that the normal range for ALT can vary between laboratories, so checking the reference range on your specific test results is important. Then we have albumin. Normal range is 35 to 57. Low albumin levels can indicate liver or kidney disease, inflammation, or poor nutrition. High levels are less common but may indicate dehydration. Then we have ALP. Normal range is 35 to 120. High or low levels of alkaline phosphatase can indicate serious conditions related to the liver, bones, or other bodily systems. High ALP can also be a sign of bone disease like Paget's disease, rickets, bone tumors, or overactive parathyroid glands. And low ALP can be due to medications or may indicate nutritional deficiencies, including lack of vitamins, minerals, or protein, as well as it can be a symptom of hypothyroidism or pernicious anemia or other issues. Again, in the interest of not making this too long, I will continue this in the next segment, next clip. Hope this has been helpful. Like and follow for more. Be the light.